later on because I forgot it's in Eastern time.
Oh, right, right. Your mountain time, is it?
Yeah, in Arizona.
Okay, okay. Wonderful. So today I wanted to get a more in-depth look at your health history, get a timeline of how your health has progressed, and then we can dive into the nutrition piece and take it from there.
Okay, for
Um,
sure.
so firstly, I wanted to ask if you had any knowledge of how your health was as a baby. If your parents ever told you if you had any colic or eczema, hives, any skin issues, GI issues, things like that.
No, um, not really. I mean,
Okay.
is the as a kid like apparently I'm told that there used to be a thing where because we have a big extended family and
Right,
there's like lots of kids, like 12 kids between like three, four sisters, and I
right.
was I was kind of the kid that they would say that oh of course nothing would happen to him, like he can
Right.
get play in the rain, eat all kinds of food, and it's fine because I would like barely ever get sick. Um,
Hmm.
Now one thing I did have though that was for a while, like it was on a couple of years, was sinusitis.
Okay.
Um, like I just had a runny nose all year round, and I would have just kind of like my sinuses would be kind of stuffed. Um,
Hmm.
but other than that, like I wasn't ever allergic to anything or have any kind of issues of like any kind that we knew of.
Okay. The sinusitis, when did that start? How old are you approximately?
My mom said like since I could barely walk, like I had it um,
Okay.
so pretty young, like let's say 2 years old, and I had it for like 3 to 5 years, like up until
Okay.
like I was like almost 7, 8 years old. I just had a runny nose all the time.
Okay. Okay. Um, any history of, as a kid, any history of uh, joint pain, back pain, or joint injuries, muscle, um, like spasming, or anything of that sort, muscle tightness?
No, not really. When I was like 12 or 13, I
Yeah.
fractured my arm because I fell off a trampoline.
Okay.
Um, that was the only kind of broken bone or anything like that.
Right. Okay.
Um, Other than that, there's nothing joint pain or anything like that.
Okay. All right. From your childhood years leading to adolescence, any symptoms or injuries during that time? Any other sinus infections or any other infections that occurred?
No.
Okay.
After childhood, I had not really any other issues. Like I wasn't I wouldn't say I was like particularly athletic. I was
Right.
more of a like a weaker kid in the sense if you were like comparing with athletics, like I just wasn't
Mm-hmm.
into sports. I wouldn't like playing stuff. But like
Mm-hmm.
but I could like I didn't have any issues. Like I wouldn't get sick much. I wouldn't get the fever when other people would get the flu, and I
Okay.
wouldn't get the stomach virus when many other kids in the class would get it, stuff like that.
Mm-hmm. Okay. All right. Leading into your high school years, any injuries or symptoms, medications you're taking during that time, or anything else that developed?
Um so right before high school I had to get like a lot of my teeth work done because I was like
Okay.
eating a lot of chocolate, and I wasn't like taking care of my dental health as a kid. So like I had a
Mm-hmm.
lot of cavities that they had to
Mm-hmm.
work on. About like I think it was almost all my teeth. It was like pretty much like other than 4 or 5 teeth, I had cavities in all of them. So that's one thing. And then
Okay.
the biggest thing in high school was motorbike accident that started the entire journey.
Okay. And how old were you when you had the motorbike accident?
It was in 2000, like end of 2011. So
Okay.
like about 18.
Okay. How severe was that accident?
So I broke my jaw
Okay.
on both sides, and it wasn't that severe in the sense that like I just had my jaw hung like bandage to my head for I think it was like about a month, like 3 4 weeks where I ate soup,
Okay.
and that was it. We thought that was the end of it. Um,
Right.
it's just I fell off a motorbike. It wasn't going that fast. It's just that
Right.
I fell and just landed on my chin.
Oh, okay.
And then I got unconscious for about 5 minutes. Um, and then I was just taken to a local hospital to get some stitches, and they didn't do any other type of evaluations or any kind of checks.
Did they do any imaging, like an X-ray or
No,
anything like that? Okay.
no, it was it was in Thailand. It's a terrible, and then it was like a local place just to get the quick stitches, um,
Okay.
to stop the bleeding, and then that was it. The like later when I got the jaws, they just worked on the jaw to get like the bandage, but then I didn't do anything else after that.
Okay. Um, so all of this treatment was in Thailand, like the stitches and then the bandaging.
Yeah, it was in the same night.
Oh, I see. Okay. Did you ever get any follow-up imaging of your jaw afterwards, or not at all?
For my jaw, like I started to look into like do MRIs and everything,
Right.
for my head and neck in like 2013, 14,
Okay.
and then like pretty much every other year I would try to go in and get some kind of checkups done through my health insurance because that's where the problem started to really set in. So I got a bunch of imaging around that time, but it wasn't particularly for my jaw. The jaw, I only went to the dentist around 2014, and I got a
Okay.
mouth guard because I was grinding my teeth at night.
Okay.
And then I had to use the mouth guard from then till like 2021. I only recently, a couple months ago, stopped wearing it after did some work with my chiropractor who did
Okay.
some vagus nerve stimulation, and then that
Uh-huh.
alleviated my grinding.
Oh, that's awesome. Okay. So when you got the MRI imaging for your head and neck, was there any findings that they found
No.
or anything? Okay. And then also during that time, were there any additional changes to your health?
During 2013-14, like that?
Yeah, I guess from the motorbike accident in 2011 going forward, did you notice any kind of changes with your health?
Yeah, a lot. Here,
Okay.
1 second. Let me just
Sure.
pull it up. So we have this like a calendar of symptoms.
Right.
And so like around that time, yeah, 2012, like the very first symptom that I realized was that I can't go near smoke.
Okay.
So I remember right after the accident, like my friends would be like we were in high school and they would be smoking and drinking and stuff, and I would realize like I can't even go near them because I start to like suffocate.
Okay.
And then that was the one symptom, and the only other symptom I had at that time is that I can't eat like oily food. Anytime I would eat like a burger, I'll start to have like like shortness of breath, dizziness, vertigo. So I just kind of stayed away from smoke and burgers for like a couple of years until my jaw pain started, which was about like 2 years after the accident. And that's when I got the mouth guard, and that helped a lot. And I just been wearing that, and that alleviated most of that stuff. But then in 2013, I started getting more sensitive to oil. Like I couldn't like gradually it went from burgers to have to eat like mainly foods that are not too much oily, and then it came like I can't really eat most foods that are outside, so I'm like cooking and learning to cook now because they're just giving me too much symptoms. And then when I'm cooking, then it became that I can't cook with like canola oil. I had to move to olive oil and coconut oil, which felt like it alleviated everything at that time. Um,
Mhm.
but should I keep going like with the trajectory like that, or
Yeah, that's fine. So, you couldn't tolerate the canola oil, so you switched over to olive oil, and that was a lot better for you.
yeah?
Okay. Yeah, you can go ahead.
And then at that time I would just have like constant mucus build up. I would like every morning I would just get up and I would have to just like cough out a lot of phlegm.
Okay.
Um, and then around this went on for like about a couple of years, and it was just around there. It didn't get much worse, so I didn't pay much attention. I did go to the doctors. I was on antidepressants for some time because they had me go to the psychologist and then a psychiatrist for about like I think 6 months, about 4 to 6 months. But
Okay.
then
Were
I
you diagnosed with anything during that time, or?
no, it's just like they said it was anxiety that I'm just getting anxious because I moved to a new country,
I
basically.
see. So did they diagnose you with generalized anxiety disorder, or they just gave you antidepressants?
Um, no, they didn't. I don't think they diagnosed me. I don't remember being diagnosed, but I got some medication for it,
Okay. And how long were you taking those antidepressants for?
like 6 months.
Okay. And was that helpful for you?
No, it got me worse.
Oh, okay. And what your anxiety worsened, or other things worsened as well?
No, my dizziness and stuff like that. The symptoms were worsening.
Okay. The dizziness, shortness of breath, vertigo.
Yeah.
Yeah. Okay.
Um. So yeah, that was like about 2015, and then around like 2015, things started to get like a little bit more heavy. Like I realized I can't eat like a lot of foods now. Like anytime I eat like chili or even some like kind of paste, tomato paste, stuff like that, I would start to have problems. I couldn't eat like normal like just like any kind of sausage just bought from like like Stop and Shop or something like that. I would start to have some issues. So I started to like um, kind of just go towards eating boiled chicken. Um, and I made that shift like in 20 about end of 2015, 2016. I was just eating like boiled chicken with salt, and then
Mm-hmm.
I would broccoli, rice, and eggs. That was
Okay.
my breakfast, lunch, dinner. Um,
Okay.
and
And you're only eating those foods.
only eating those foods, yeah.
Okay. Okay.
And I'm having reactions to other stuff. And at that time, I didn't even call it reactions. I just didn't feel good. And when I would look it up, like, why do I feel, like whatever when I eat, like, let's say chocolate? They would say, like, chocolate is bad because of this, this, and this. And then I just didn't realize, like, the extent when other people say it's, like, not good for you compared to me, like, where I, like, losing balance or getting vertigo attacks. Like, um, you know, I didn't take it as seriously as I should have at that time. I just went to avoiding it mode. Um,
Right. Um,
and yeah.
sorry. The foods that you were avoiding, was it mainly shortness of breath, dizziness, and vertigo, or were you experiencing other symptoms as well with other foods?
So 2015, the main symptoms I had was like, yeah, shortness of breath, vertigo, dizziness, and
Right.
nothing more serious came in yet. 2016, 17, I started to get a little bit more like where my heart rate was always, palpating. I can hear it in my head. It was around the first time where I realized that I can't exercise anymore. Like even going for a
Okay.
jog gets me extremely um, like just overwhelmed, dizzy, and very like just unstable. Where I'm having like hard time coordinating between like moving from exercise stations to another exercise because of like me just exerting a little bit of energy. Whereas before I could
Mm-hmm.
just push myself until I get tired or something.
Mm-hmm.
Um, so those kind of stuff started to come in, so I couldn't go to the gym as much. I started to realize my whole body would be trembling, like a little bit of cold, like just getting from the car to coming in the house. if I'm exposed to cold, I would be trembling for a couple hours, just shaking, and then I would start to have constant, like, at that time it was just either constipation or diarrhea. I would just go from one or the other fully and not ever be balanced. This was in like 2017.
Okay.
And 2018, it's the same stuff, but it got a bit more serious. Whereas like before, if I ate a food that I'm not supposed to eat, it would be like some pain for a couple of days. And by 2018, it's like if I eat a piece of chocolate, it will take 3 to 4 weeks for me to recover, and come back to where I can feel kind of normal again. And I would get full body numbness and tingling. Like it just feels the entire body's like on, I guess some people say fire, but it's not really fire. It's just like, it's like tingling pins and needles, but it's like almost the entire body. It's very extremely strange and very scary in the beginning when it started to happen. But I would go in these kind of modes where I would stand up and my whole body would be tingling, starting from like the feet all the way up. And then that's kind of like, where I was at until like 2019. 2019 was the first time where I realized that I had those bouts where I can't get out of bed. I just can't get out. And then even typing the password on my computer is like so much pain in my wrist and hand. Like there's like sharp shooting pain, me trying to just type a password. And then I would just have to lay, and I had to like stop everything and try to get help from doctors. It's where I went and redid all the tests I did, which is like, I think they said like 11 pages. Like with my health insurance, I asked them to get a report recently. They said I had like 11, like each doctor I went to is one line, and there's like 11 pages of doctors in the last decade. So I went back and did like, not all of them, but a lot of them again. Like I tried to check my, everything again, MRI, ultrasounds, cardiovascular, GI, got an, what did I get? That thing where they put the pipe down your throat to see if you had to like drink some stuff. And so all that kind of stuff I did again, everything came back perfectly normal. And then again, I was kind of like led towards getting anxiety again, like kind of taken that direction by recommendation. So I just stopped because I've been, down that road before. And then, so that's 2019. By 2020, I only had a couple of foods. So I could eat no more normal potatoes. I could eat like edo. It's like a type of root vegetable. And I would eat that with a soup. And then I would eat salmon and sweet potatoes. By end of 2020, so last year, I lost even that. And right now I'm down to my 2 foods, salmon and sweet potato. 2 weeks ago, I got an emergency. I had to go to the ER because I ate a potato it's the same potato I always eat. It's an organic sweet garnet red potato, but it was the same thing, but from another farm than what I normally get. And it set my reactions, and I lost balance, and like couldn't breathe, and I had to go to the ER. This was just like 2 weeks ago. So that's how sensitive I am to changing my diet. Like a piece of carrot or banana can cause like completely, me to almost like suffocate, blackouts. So I just wanted to add that last part.
So sorry, when you had the organic the garnet sweet potato, was it sweet potato?
Yeah.
Okay. You lost your balance, and what other symptoms did you experience?
It was like shortness of breath.
Right.
Balance is off. Can't tell if I'm standing or straight or not, so I'm like kind of like falling. Have to walk with the wall. And then like dizziness, which is different than balance problems. I could have balance without dizziness. It's just balance, but my vision, everything is clear. But I was getting dizziness as well. I didn't get a vertigo attack. That's usually makes it a lot harder when the room starts completely spinning, because then I have to sit down where I am and just close my eyes. So that didn't happen, but I was getting dizziness, balance problems, and mainly shortness of breath. The one that's getting worse right now is my shortness of breath. When I have flare-ups, every time I've been having shortness of breath for a long time. But nowadays it's like it gets to a point where I really feel that I can't breathe. I don't panic as much as I used to because I just been having it for so long. I just try to like sit down and kind of meditate. And normally, whenever I do that, within about 10 minutes of as long as I focus on the meditation and the breath and the counts, I get to a point where I can catch my breath. But lately, even with that, I would be able to like struggle to catch my breath. Um, and it's the first times that it's showing up in the oximeter. Normally, for the whole time, whenever I'm having shortness of breath, I check the oximeter. My oxygen level is fine. It's just that I can't get a satisfactory breath. But this year was the first time where when I get my flare-ups, I check the oximeter, and last time I was at like 62 oxygen. So that's a little bit new in that like it's actually showing my oxygen levels are lower. So yeah.
Okay. Do you know what your blood pressure is, like average reading for you?
Not really. I know that it's usually low. I can do it right now. It's next to me.
Okay. Sure. If you wanted to.
All right, one second.
Yes.
Yeah.
Okay. Would that also elicit feelings of not being able to get out of bed, or were they causing other kinds of symptoms?
Chicken, yes. Chicken, if I eat a piece of chicken, then like I get severe reactions. I can't like get out of bed and can't breathe and everything. Broccoli is a little less. The last time I ate some broccoli and carrot, just boiled it with a little bit of salt. I just had like balance problems and head pressure increase and dizziness, but I didn't get to the point where like I can't like get from one room to another. And also it doesn't last as long. With broccoli and carrots, it'll be like about a week of symptoms, whereas if it's chicken, it lasts more than a month. Like sometimes it feels like it'll never go away because it lasts like about a month and a half.
Right.
The last time I tried it, so it's very long. The effects stay.
Right. Okay. And then the rice, what were you experiencing with the rice?
I would say it's in between the broccoli and the chicken. So worse than broccoli and carrots, but not as bad as the chicken. It's about like a week to 2 weeks of dizziness, vertigo, a little bit of shortness of breath.
Okay. And this was all in 2019 that you experienced all these reactions to these foods?
Yeah, it's I had it also in between. From time to time, I would think that I'm getting a little better, and then I would have a cup of rice. Then I'd realize I'm not. So
Right.
that's how I remember the effects a little bit more clearly, because the last time I had it was like 6 months ago. On New Year's, I had a piece of chicken that I got convinced from a consultation I got that if I get grass fed chicken, not grass fed, I mean like they're free range, which is already getting, but they said that, oh, those are free range only half their time, not for their whole life. So I got this chicken from like, apparently it's like their whole life is, so I thought this might be different, but then I had that in New Year's, and I pretty much ruined my entire New Year's until the end of January from that piece of chicken.
Okay. The motorbike accident, was that just you had one motorbike accident and that was in 2012, correct?
Yeah.
2011. Okay. And then the IgE food allergies. Have you had like a serum test or a skin prick test?
I had skin prick test. Nothing came up.
Oh, okay, skin prick test. Okay. And then, do you have a confirmed mast cell activation diagnosis?
I don't.
Okay, suspected. Okay.
Yeah.
And then I know you crossed off. Is it Crohn's, ulcerative colitis, or celiac?
I'm not. I know like I have a lot of the symptoms similar to SIBO.
Okay.
But it's not it's not like diagnosed. It's just me self.
Right.
Yeah.
Okay. And then IBS. Were you diagnosed with IBS-C, IBS-D, IBS-M?
I wasn't diagnosed.
Oh, not diagnosed. Okay. And how is your hand pain now? Do you still experience that?
Yeah, I can't
Okay.
use them. I use a computer with my foot. I have a foot mouse. I can't
Okay.
really use a mouse normally.
Okay. And has the chiropractor also been helping with your wrists? Like, are they addressing your wrists as well, or
No,
no? Okay.
no, because my chiropractor basically believes that most of my issues are from my vagus nerve damage. So that's what we focused on, and
I
um,
see.
so yeah, that did make a difference though. Out of like 34 doctors, I would say like
Right.
previously, that was the
Yeah.
only thing I would say that gave some kind of immediate relief. Meaning like I went there, got the treatment, and right after that I felt
Right.
better. My vertigo went down. I was getting about three,
Oh,
4 times a week. After that, I started getting it
oh,
like once, twice a month, if that. And then also my mouth guard grinding went down. So that kind of confirmed me that probably something with my vagus nerve is really damaged um,
right.
from the bike accident. But yeah, that's what we got from that.
Okay. And how often do you experience the vertigo currently?
Currently, not as much. The last time I probably had it was like 2 months ago. Um, so it's not as much. I just control everything properly. I realize that I'm like I can eat salt, but I'm sensitive to it. Like if I have the salmon and I put some salt in it, and sometimes if I put a little bit extra, then I can have a vertigo attack just from eating the salt. So I realize that I have to put just enough salt where I can't really taste their salt. It just has enough for me to make it edible, like taste
Right.
something.
Okay. Can too much salt also give other symptoms, or is it mainly the vertigo?
It depends how much. Like if I eat where I can like actually taste, there's a good amount of salt there, then it's gonna do a lot more. It's gonna do, I know, like heart palpitation, shortness of breath. It's probably gonna bring on a lot more symptoms. But if it's just mildly, I extra put a little bit, then um, for some reason it triggers the vertigo more than any other
Okay.
foods. The salt.
Okay. Do you use salt now, or do you use it sparingly now?
I use it. I just put
Okay.
very very little,
Okay.
and I only use Himalayan pink salt.
Okay.
It's like a little less salty than normal salt.
Okay. Do you respond well to the Himalayan pink salt the best?
Yeah,
Okay. How are you with sea salt?
not good.
Not good. Okay. The vertigo?
Yeah, vertigo, dizziness.
Okay. Any other joint pain anywhere? Any tingling and numbness currently?
Not tingling and numbness, but I have joint pain. Like I can't walk much. Um,
Okay.
I can walk like a couple of blocks, but if I try to go for a walk 5-10 minutes, then my shin and ankle and feet they start really aching a lot. I have to kind of limp. Um, so I have like joint pain that way. I have joint
Okay.
pain in my hands. Um, just generally overall, like my joints feel a little bit more weak. Like if I sit on the floor, I have to cross my legs. It feels like it's like kind of bending my bones, and it hurts for like a couple of days. Even if I sit for like a couple of minutes on the floor, um, if I lay down a little bit bent, my back starts to really hurt. Even if it's like I have to just be perfectly like aware and positioned, sit
Mhm.
very slowly on the couch, and make sure I have enough support at all times.
Okay. Um, any joint pain in your hips when you walk,
Not when
or
I
your
walk.
back? Okay. Any joint pain in your hips at all?
In my hips when I like if I try to cross my leg or I sit down straight, like I have to sit down in a couch or a chair or something, but if I try to sit down on the floor or something, or like cross my legs, then I have hip pain, but not normally. I don't have it. Or if I sleep on my sides, then I have a lot of hip pain and a lot of back pain. I always sleep on my back straight, and then sometimes in the middle of the night I might turn a little bit, but then the pain starts to come and wakes me up, so I have to I kind of just like adjust and make sure I'm facing straight.
Okay. And how is your sleep currently?
So sleep is better now. I started taking ketotifen not too long ago, and
Okay.
this has helped a lot. I just had like some issues with it in the beginning when I tried it. It gave me head pressure, but what I did was the ketotifen is 1 mg, and we got just empty capsules, and we divide one capsule by 10. So I take 1/10 of a 1 mg, and that helps.
Okay. Do you do that once daily, twice daily? How many times daily do you do the 1/10? Once daily?
Yeah, after lunch.
Okay. 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 Are you doing any other medications currently besides the ketotifen?
No.
Okay. And then with regards to your sleep, how many hours of sleep are you getting per night?
Like 6 hours, 7 hours
Okay.
a night. And I was getting about 3 hours before.
Before the ketotifen?
Yeah.
Okay. Okay. So the ketotofen's been helping with your sleep. Have you noticed that it's been helping with other things?
Yeah, I don't think with much other things. The sleep
Okay.
is a big one. When I was sleeping 3 hours, I felt like sleep was my main thing because most of the night I would just lay awake until my back just starts hurting, and that would be like every single night until like 3-4 nights when I would get so exhausted I would collapse, and like then I'd get a couple hours of sleep in a row, but I would just have like I would be waking up every 30 to 45 minutes normally without ketotifen, and then I would have trouble falling back asleep. So once my sleep got better, it felt a lot better. But yeah, I don't see much else. It probably is helping, I think, but it's hard to tell because like I get worse as time passes. Like every 3 months is a different type of like intensity. Like 3 months ago I was healthier than now. 6 months ago I was way healthier than I am now.
Right.
A year ago I was almost a different person. I could eat soup.
Right.
You know, I didn't have to worry about walking around as much. So like I'm deteriorating like pretty quickly.
Okay.
So with the ketotifen, it makes me feel like I'm kind of at a standstill for some time, which is a improvement because I probably would have been worse.
Right.
Yeah.
Okay. Are you doing any supplements currently?
No, I can't tolerate any supplements.
Okay. What kinds of supplements have you reacted to in the past?
Like vitamin C, multivitamin, magnesium, digestive enzyme.
Okay. And what kinds of symptoms would they give you?
Balance, dizziness, shortness of breath.
Okay.
These three mainly.
Let's see here. Any environmental or chemical sensitivities?
Yeah. I can't be near like deodorant or detergent, soaps,
Okay.
any kind of laundry. So we use everything organic. I even react to organic ones. I have to just find within the organic ones which ones I don't react to. But yeah.
Okay. And then I know in intake form you have a cat. Is that correct?
Yeah.
Okay. Any sensitivities to the cat at all?
No.
No.
Surprisingly,
okay.
none.
Okay. And then any sensitivities to any materials?
Like I can't put much stuff on my skin. Like I can't put lotion.
Okay. And what happens if you do?
Dizziness. I feel
Dizziness?
like I would start to get vertigo, a little bit of balance problems.
Okay. Okay. Let's see here. And how is your emotional health currently?
I'm okay, given my condition. I would say
Right.
not that as bad. In the evenings, I start to get a little bit stressed. Usually, like just at night. It's just in the early hours of the night, anywhere from 11 till 2 a.m. When I wake up, I often am like about 2 times a week, 2 3 times a week, I start to like kind of question like if I'm like certain things happen where it makes me just get down and question if I'm gonna be able to make it past this night. So that's probably the scariest part emotionally.
Yeah. Yeah.
But other than that, um, I'm okay, and that just happens because again, shortness of breath, and I just feel like even when I move my head like an inch, like it's like my whole body has to catch up. Like there's a delayed reaction, everything from my vision to my breathing to my like it just feels really off in the early hours of the night. So it starts to always kind of like get me down to start questioning. And sometimes I get up and have to go drink water or check the oximeter, take blood pressure, and try to just drink some water and see if I can like shake it off or something. And just I mean, it's just that's just kind of like how it is now. I don't wake up anybody anymore because it's just it's kind of like unfair to everybody in the house nowadays, like making them go through the same thing over and over again. But yeah, I mean that's emotionally. I think I get challenged at early hours of the night, like about 2 3 times a week. But other than that, I mean I'm fine still. I'm just trying to find out what's like what is the actual cause of this.
Right. Okay. Um, so most of those kind of like worrying thoughts happen mostly during that time?
Yeah, it's like I get waken up and then I
Right.
start feeling because I'm feeling really off, and then
Right.
it gets me kind of startled sometimes. My heart rate like races to like about 120, usually 120, like resting heart rate. That's
Right.
makes it worse because now I have to like really stay calm and try to
Right.
like breathe and calm down my heart rate on top of the symptoms. So it's like it just kind of throws me for a loop. Even though I go through it often, it still gets me like suddenly.
Yeah. I did want to offer. I know you had spoken to Jamie as well previous to this, and she does have a free group class if you wanted to join the next one, just so you can speak more about kind of like these fight or flight reactions that you experience, and basically she can speak more about ways to kind of like calm your mind and body, and essentially what she does is help patients create new, I guess, neural pathways to kind of steer away from some of those I guess like negative emotions, and bring more like I guess clarity and understanding to what a patient experiences. So if you'd like, I can definitely have Tracy send over a Zoom link to her next group session. I think that could be something that could benefit you, especially during those moments where you feel startled in the middle of the night, and you experience the symptoms during that time.
Okay, yeah, that sounds good.
Yeah, awesome. Okay. So let's talk GI symptoms. Do you have any bloating or abdominal pain?
I have abdominal pain.
Okay. Is that pretty constant, or does that occur after eating, or?
It only comes at night for some reason.
Okay.
Like after dinner, it starts to come in, and I have it early hours into the night. It's usually there when I get those startled moments. And then it's kind of gone again for the rest of the night and day, and it comes again in the evening. So it's pretty constant, but it's just around those times of the night.
Okay. Do you experience that nightly?
Yeah.
Okay. Okay. The salmon that you eat, do you buy that fresh or frozen?
Frozen.
Frozen? Okay. And do you get that from the supermarket, or do you buy that online, or?
I get this from either Whole Foods or Albertsons. It's the same brand. I just get the same one every time. It's wild caught Alaskan salmon. And I react to even the other types. Like I got wild caught pink salmon, and I reacted to that.
Okay. Any reflux symptoms?
No.
No. Okay. Any choking on food or difficulty swallowing?
No.
No. Okay. When you eat, do you feel easily full after eating, or do you feel food sits in your stomach after eating?
Sometimes I feel like the food sits in my stomach.
Okay.
I just feel like there's a heaviness in my stomach after I ate, and it's just there for some time. But the fullness, I don't let myself get any full anymore. I eat about 7 meals a day. I used to eat every hour with a clock that I rewind every hour, where I'd be able to eat a little bit because I couldn't eat too much, and I can't eat too little either because I lose weight very rapidly. Like if I eat 3 meals a day, then I can lose I think I can lose 10 pounds within a week if I want it. All I have to do is eat 3 meals a day. It sounds kind of like not possible, but I've done it. Where when I had to go get my gallbladder surgery, we only eat soup for about a week, and I went from 120 to 105, and I had to go to ER because I wasn't eating for about 5 days solid foods after the surgery. So for some reason I lose weight really rapidly when I don't eat. So I don't get full easily. I just don't let myself get too full or let myself get too empty. I have to eat the first time I do in the morning. I get up right away. I have to eat the food, my first meal, because I cannot speak until I eat. That's another thing. I don't know why, but the words don't come out. They hurt. Like my throat is so sore until I get my first meal in. Then I can start speaking.
Okay. So your throat is sore when you wake up?
Yeah.
Yeah. Okay. What's your weight currently?
115.
115.
Yeah.
Okay. Any nausea or vomiting?
Not vomiting. I do feel nauseous sometimes when I have my stomach aches at night. But it's very mild.
Sorry, could you repeat that? When
I have the stomach aches at night.
Oh, okay.
Around that time I feel nauseous. Sometimes it's pretty mild though.
Okay. All right. And then how often are your bowel movements daily?
Every other day to every 3 days.
And consistency of the bowels?
Firm.
Okay. Um, any, oh, sorry, what's the color?
Brown, orange.
Okay. Any straining at the stool or straining at the stool or pain?
Usually no, but there is blood in stool.
Okay. Is that every time you have a bowel movement, there's blood?
Not every time. I would say about once a week I can visibly
Okay.
see it.
Is the blood fresh or is it like darker?
Fresh.
Like it? Okay. All right. Do you ever see any undigested food particles in your stool?
No.
No? Okay. The magnesium that you previously took, was that for your stool or was that just for muscles
Yeah, it was
spasming?
I thought it was gonna calm down my jaw clenching.
Oh, I see. Do you remember what form of magnesium you took?
I think it was just called magnesium citrate.
Oh, citrate. Okay. Okay. And you reacted to that eventually or right
Yeah.
away?
Yeah, it took like some time though. I didn't react immediately. It took like 2 days.
Okay.
Normally, it's within like 5 minutes of eating something.
Right. Okay. Um, so with regards to your skin, any skin transparency?
What does that mean?
Like, you can kind of see your veins a little bit more prominent. Um,
I mean,
either,
yeah, I would say my veins are very like noticeable. I'm told
okay.
easy to inject.
Okay. Um, does your skin have like a velvety texture?
Velvety texture? I don't think so. I'm not.
Okay.
I can Google it. Velvety means like it looks like smooth or something.
Velvety is like, like felt. It kind of has like, I guess like, typical skin would be like smooth, whereas velvety, there's like I'm not sure how to describe it. It's like there's a certain texture to it that's not smooth. Do you feel like your skin is smooth, or do you feel like it has like a certain texture to it when you touch it?
I feel like it's normal. I think.
Okay.
I think so. I mean, it kind of seems like it's kind of like a little bit more like crunched. Like I feel like my skin sometimes looks like I'm older than I am. Like it kind of looks like it's starting to like getting wrinkles a little bit.
Okay.
But on my face it looks completely fine. Just maybe my arms and legs it kind of like looks. I don't think I have. I think I'm just trying to maybe find something where something might not be.
Yeah. Okay. Nice. Do you notice that if your skin is stretchy at all?
Yeah, it's pretty stretchy.
Okay.
I mean, one second. Let me just see.
Sure.
Let me just check something. Try it. Oh, no. Okay, sorry about that. I just wanted to check. So my skin is way more stretchy than other people. I never realized this before. But it
Okay.
comes like very far when I pull it.
Okay. Um, are you able to, if this is too much, you don't have to do it. But if you're able to, are you able to stand and bring your hands flat on the floor without bending your knees? Or would that cause you dizziness?
No, I can't do it. I tried. I did like I never tried anything with the skin, but I did like bending my thumb backwards, trying to touch the floor when I was watching a video on EDS. Um,
Yeah.
but I couldn't do any of that stuff. My joints are very stiff. Um,
Okay.
but this is the first time I'm trying the skin, which does seem it's a lot more stretchy than other people in the house.
Yeah. Yeah. Okay.
But is it the same diagnosis? Like EDS, can you have stretchy skin without joints?
Yeah, some patients can be stiff as well. Um, have you ever had any history of flexibility?
No, I was always
No.
unflexible.
Okay. Um, do positional changes make you feel dizzy, like from sitting to standing or from lying to sitting?
Yeah,
Okay.
sometimes I can have a full flare up if I get up too fast.
Okay. Um, regarding previous lab testing, we like to see the past two years of any lab testing a patient has completed just to get a better picture of their health journey, as well as to if there's any need for repeat lab testing, we can avoid that as well. So if you could send over any previous lab testing of the past 2 years, that'd be really great, just so that we can kind of see your health journey through the labs you have completed, and then if there's any other additional testing that we would like to see, we can definitely let you know of that as well.
Where should I send it?
You can send it to, so I'm going to send you some stuff as well, so you can send it directly to me, if you can have it in PDF format, or you can send it to Tracy.
Got it.
Yeah, that'd be great. Another type of testing that we like to pursue as well with our patients is called a metabolomics test. Have you heard of this kind of testing before?
No.
No? Okay. So our main priority is, looking at the root cause of disease as well as underlying function. And a metabolomics is not diagnostic in nature, but it does allow us to see, how the body is functioning at a cellular level. So through that, we can analyze different biochemical markers, which include assessing nutrient status. If there's a food category intolerance, whether that be sulfur, histamine, salicylate, oxalates. We can also measure level of oxidative stress, as well as neurotransmitter imbalances, gut dysbiosis, bacterial imbalances. And so it's a urine test, and it'll be the first morning void collection. The test does get sent to your home, so it can be completed from your home. And it also comes with the FedEx overnight shipping label, so it can be picked up from your doorstep. When you do receive the test, it may come with other samples, like for a blood spot or a cheek swab, but we only want you during doing the urine test. Pricing for this test is $2.99, and you don't pay until after you complete the testing. It's not covered through insurance, but what you can do is after you complete the test, the lab is through Genova. You can ask or request a super bill for that, so you can submit that to your insurance and see what you can get reimbursed. It takes about 2 to 5 business days for it to arrive, and we're seeing about 3.5 week turnover for results to come in.
Sure, yeah, I'd like that.
Awesome. Great. So I'll have Tracy go ahead and order that for you today. So it should get sent to your house. Yeah, we really like this test because it gives us an idea of how the body is functioning with regards to the biochemistry. And oftentimes the biochemistry is a good starting point to see how we can address it, there are certain pathways that aren't working as efficiently. That can be really helpful in determining, what cofactors or mineral statuses and are needed to help those pathways become more efficient, which can, bring some sense or increased stability to the patient as well. So with regards to your diet, about how much salmon and how much potato are you having in a day?
I have 2 pounds of salmon per day.
Okay. And potatoes?
The potato, let me see. The sizes change, but we measure it every morning. It's around 2,000 grams, so about 4 pounds.
Okay. And is this the Edo potato, or is this another type of potato that you're doing currently?
This is the organic sweet potato.
Oh, the organic sweet potato. Okay. So not the white potato.
No, I cannot eat that one.
Okay. Okay. All right. Any flushing or hives with foods or at all that you've noticed?
No.
No? Okay. And then fruits, how are you with fruits? Were they kind of giving you the same kinds of symptoms as well?
With fruits, I have the same symptoms, except I get bloated like a balloon. Like if I eat one grape, my stomach bloats so I can't. It's like hard for me to breathe. It's very strange. I'll just I'm talking about like 1 or 2 small grapes, like green grapes. It gets me super bloated, and then I have the same symptoms.
Okay. Have you noticed that with fruits, or did you just discontinue eating fruits altogether because of that?
Yeah, I discontinued because I started to have it first with mangoes, because when my diet started to get restricted, I kind of started eating more fruits, as it was my snack in a way. I would eat like watermelons, mangoes. It started to happen with mangoes first, then I stopped, and I started eating just watermelons and grapes, and then started to happen to grapes and blueberries, very strong, but not as strong for bananas and watermelons. And then it started to happen to bananas and bananas and watermelons and everything, pretty much. So that was like, I kind of tried a couple of different fruits, and it started happening all for, overall, all of them, kind of. And then I just stopped. But I realized that it is abnormally more reactive, or like bloating, with grapes and blueberries compared to like a banana.
Okay. So grapes and blueberries was more pronounced symptoms.
Yeah.
Okay. Have you tried it both, like eating the fruit raw and in a smoothie form, or mostly when you have it raw?
I haven't tried smoothie form. I only had it raw.
I see. Okay. So has it been a while since you've eaten fruits? Over a year or so, or 2 years? Or?
Yeah, no, not that long. I ate some grapes last year. I think about a year ago.
Okay. Okay. And then, how are you with like beans or legumes?
Not good at all.
Okay.
Both are very problematic.
Like the shortness of breath and dizziness.
Shortness of breath, dizziness, heart palpitations,
Okay.
very hard shortness of breath. I tried lentils specifically because I'm from Bangladesh and my mom made some lentils that she didn't put anything, like not even turmeric,
Right.
it's just lentils, some salt, it's organic lentils. I had like a little bit of it and it was really bad for about 2 weeks.
Okay.
But no bloating, it's just vertigo, dizziness, shortness of breath.
Sorry, with bloating, dizziness, vertigo.
Vertigo, shortness of breath and dizziness. Bloating is like more with fruits.
Bloating with fruits. Oh, okay. Any other symptoms of fruits besides the bloating?
I get the same symptoms plus bloating.
Okay.
That's pretty much it.
Okay. Okay. So what I want to do is I want to send over. We have a histamine tracker list, and I'm going to send that over to you. And if there are any foods on that list that you have had no previous reactivity to, we can kind of create that list and come back to that. So when the time is right for a food reintroduction, and you're in a more stable place, we can definitely refer back to that list and see if there are foods that on that list that we can look to reintroducing as well. But generally, when we do food reintroduction, we always look to the foods that you're currently eating and expand with the similar food families from there. And then we look towards foods that you've had no previous reactivity to, and then expand from there. So I'll send that over to you. And then we have a low histamine diet PDF as well, just for you to read over. And then I'll also send over a introductions handout, and basically it outlines how when it comes to like a food, a medication, or supplement, it basically outlines the introduction process. So essentially, when a patient introduces something new, we always ensure that that's the only thing that they're introducing during that week. And it's a low and slow process. So if it's like, for example, if it's a supplement that we want to introduce, we would always have the patient can do a skin patch test first to assess tolerance, and then move on to the mouth, outer lip, the inner lip, and the tongue. And if all that goes well, then the next day they can open up the capsule and put a little bit in water and see how they go from there. And then if all goes well, they can slowly look to increase the dosage, eventually working up to the full dosage. So that basically is an overview of how we introduce, either like a supplement or a food. So I'll send that over to you as well. I did want to ask what your current water intake is.
I take exactly 64 ounces per day.
64 ounces, okay. And then I definitely think the next step, are you currently scheduled in with Dr. Maitland, or are you looking to...
Yeah, I'm scheduled in.
Okay.
I think I was going to ask if there was some cancellation or something, because I have her all the way in September 24th.
Right. I can ask Tracy if there's a cancellation list. I'll I'll let her know if there is to put you on one. But I actually think in the meantime, you could also benefit from seeing Dr. Brock as well. She is our EDS specialist, and I think it may be worth speaking to her as well with regards to the joint pain you experienced, as well as she'll be able to help, guide you with regards to that.
Is there like something you take to see if I have EDS?
If you wanted a diagnosis, that would be through a geneticist. She would be able to indicate to you whether there is presence of a connective tissue disorder, but a definitive diagnosis would be through a geneticist.
And is that something I can take like without going outside the house?
Yes, I think we do like to refer patients to Dr. Atwell. He's located in Florida, but I think he does do distance consults, I think through Zoom. So if that's something that you're interested in as well, I can send you a link to his website.
Okay.
Yeah.
Yes, please.
Sure, for sure. I can send a link for that as well. But is talking to Dr. Brock, would that be something that you would like to do in the meantime while waiting your appointment with Dr. Maitland?
Sure. Do you think it'll help to like just we'll do some tests to see if it's worth taking the genetics test like that, or?
Yeah, I think she'd be able to further guide you with regards to she'll be able to do I think some like physical testing through Zoom, and then further guide you with regards to whether she feels there is a connective tissue disorder going on, and whether that it would be worth looking into a geneticist for a definitive diagnosis. But I think especially with the joint pain you experience, and especially with your wrists and your shins, I think it would be really good to speak to her a little bit about that, and to be able to help you with regards to treatment options and what further steps to take with regards to a diagnosis if necessary.
Okay, makes sense. I had one question. So,
sure.
I've been like staying inside the house, like very tight with the COVID, and nobody in my house leaves the house because of me. Like we even order in all the groceries and everything now.
Yeah.
With the new variant, though, I feel like it's getting more risky for me to not take the vaccine. What would be your thoughts with somebody with my condition if I was to take the vaccine?
We're finding that overall, patients are we do have patients that have had the vaccine, and some patients have had some level of reactivity to it. Most of the time they've been tolerating it well when they hydrate adequately and when they pre-medicate beforehand. But yeah, we've been seeing, just as long as with proper pre-medication and hydration, there can be they can be okay for the most part. I think it may be worth also speaking to Dr. Brock when you see her about that as well. I think that could be something that she'll be better able to help you with regards to her thoughts on the vaccine and what she sees with your presentation.
Makes sense. Okay.
Yeah.
Is that a call I can get pretty soon, you think, or?
Yeah, she's I think she's seeing patients a little more sooner than Dr. Maitland, so I can definitely when we get off the phone today, I can definitely have Tracy give you a call to schedule an appointment with Dr. Brock in the meantime, for sure. Yeah.
Okay, got it. Do you have any medications that you think I could like get on, even if it's temporarily, to help me get through the vaccine effects?
It's hard for me to say, since I can't tell you what medications to take. But typically our patients they would pre-medicate with like a Benadryl, and typically an H1 and an H2 blocker. So like if you do like a Zyrtec, would be like an H1 blocker, or Pepcid, which is an H2 blocker. Typically with H1, H2 blockers, Benadryl, those are the kinds of medications that patients would typically pre-medicate with.
The Benadryl, like just the normal over-the-counter Benadryl?
Yeah, over-the-counter Benadryl, yeah.
The other two, was that something you'd be, or one of your team would be able to prescribe, or?
I think the Zyrtec and Pepcid are both over-the-counter.
Oh, okay.
But yeah, if that's definitely something that you could discuss with your primary and see if that's something that would be appropriate for you. Typically, those would be some of the ways to pre-medicate with before getting a vaccine. But I would definitely speak to your primary if that would be something that could be helpful or beneficial for you as well before starting them.
Got it.
Yeah.
All right. I'll also double check with Dr. Brock for those if it's fine, because I haven't taken them. Maybe I can start.
Exactly.
Yeah. I might try taking like a very low dose, like a drop or something of Benadryl, and see how I feel. Maybe but okay, I understand. So, but it would be, at this point, you'd say though that it is more safer for me to go and get the vaccine and try to go that direction, compared to try to just stay low and try to avoid it. Because if I was to get COVID with this kind of condition, it would be like, since I already have shortness of breath, it would be probably pretty tough.
Do the people that you live with, are they vaccinated?
They're vaccinated.
Okay. Yeah, it's hard to say, because I've seen both sides of the coin. I've seen those who are out and about a lot that are vaccinated, and then there are those that have kind of laid low this whole time and are not vaccinated. But are still doing fine, because those around them are vaccinated. So it's hard to say, because I've seen both sides of the coin. But yeah, I definitely think speaking to Dr. Brock would be your next best bet to give you a clearer answer than what I would be able to give.
Okay, no problem. Sounds
yeah,
good.
I'm sorry.
That's fine.
Yeah. But yeah, I think it's great that you have an appointment with Dr. Maitland, so she can further assess the involvement of mast cell, as well as get a better look at how your immune system is functioning. And then when we get those results back, we can have a better idea of if there's any immune dysfunction that needs to be addressed, as well as anything else that needs to be addressed. That's something that you and I can definitely work on as well.
Okay.
And then in the meantime, seeing Dr. Brock will help you as well. And then what you and I can do in the meantime is we can definitely continue working together. I think the next best step would be to get the results of the metabolomics test, to kind of see where you're at with regards to your biochemistry, and how best we can support you if there's a need to replete vitamins or minerals, if you have any kind of nutrient deficiency, as well as other indications that we can help address to ensure that we fix your biochemistry where needed. and to ultimately help your body to become more stable, so that eventually we can, start to slowly reintroduce foods when that time is right, and expand your diet with time without any kinds of additional reactivity. Did you have any questions? Other questions?
No, I think that was pretty much it. The
Okay.
last question, if I have one, would be like for these moments where I get really afraid of my breathing, is there something like I can have like oxygen or something like that in the house um, that could like help me breathe better?
Um, yeah. Typically, when you see Dr. Brock, she'll be better able to help you with this. But typically, she may talk to you about an oxygen concentrator, um, to for those reasons. So yeah, when you do see her, she'll be able to help you with regards to that.
Got it. Okay.
Yeah.